Welcome to Medical Ward BSN 3B Group 3, Second Rotation NCM 116 Early, Nursing Care Management 116 Early, Medical Surgical Nursing 2, Virtual Clinical Duty. This is our third week, and of course, our focus for this week is patient IJ diagnosed with retinal detachment. But before that, please allow me to share this premise with you. I am here for you. It's literally my life's work to help you grow. And also, please allow me to share with you our learning outcomes for this week. On completion of this case study, student nurses will be able to first build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. And fifth, justify optimal therapy based on the current understanding of the case. Further, all critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Furthermore, please follow the format of your output, especially on its font style, font size, paper margin, paper size. Save it as PDF file and submit all your requirements per group on the official email address of 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 your clinical instructor. And it is advised that you will submit all your requirements on or before the set deadline of submission. And also, kindly follow this format in saving your requirements for easier monitoring for daily requirements. Abang underscore Joseph underscore 33D1 underscore NCM116 early. And then for day 2, Abang underscore Joseph underscore W3D2 and underscore NCM116 RLE. For weekly requirements, Abang underscore Joseph underscore W3 underscore NCM116 RLE. So let's now have your patient IJ diagnosed with retinal detachment. Patient IJ is a 45-year-old male, an Iglesia ni Cristo by faith, currently residing at Barangay Indahag, Cagayan de Oro City, and a public school teacher by profession. He went to the ER unit of J.R. Borja General Hospital with the chief complaints of loss of vision in his left eye that started yesterday morning and was noted to become progressively worse. Patient IJ describes the sensation as if a curtain was coming up over his affected eye. He further stated that this curtain is not affecting his central vision. Furthermore, patient IG stated that 7 days ago he noticed a flashing lights on the left eye and noticed a subsequent floaters. He also said that there was no pain, nor diplopia or even halos or other symptoms noted. Patient IG also stated that he had a cataract surgery in his left eye 3 weeks ago. Patient IG added that he had a history of hypertension but it is well controlled with his maintenance drug. He has a history of osteoarthritis with a right knee replacement in 2005. Currently taking the following medications as his maintenance drugs: hydrochlorothiazide 25 mg ODPO, lisinopril 20 mg ODPO. Visual acuity test was performed. Results show that OD is 20/25 and OS counting fingers at 3 feet. Intraocular pressure was also determined using tonometry, and the result was OD is 16 millimeters mercury, while OS is 11 millimeters mercury. Pupils are equally round and reactive to light. Extraocular eye movement were full in both eyes upon assessment. Further, during the confrontational visual field test, results show that OD was full to finger counting, OS central inferior and nasal field deficits. Another test was done using the slit lamp, and the results are as follows: lids and lashes normal OU, sclera normal OU, cornea clear OU, anterior chamber deep and quiet OU, iris normal OU, lens 1 positive sclerotic cataract, anterior vitreous normal OD, pigmented cells OS. Amsler grid was done to further diagnose the condition, and there was normal result in OD and blurry throughout with nasal regions missing completely in OS. With the diagnostic test done to patient IG, the physician finally diagnosed him of having a retinal detachment resulting from a peripheral retinal tear. Patient IJ was advised to undergo surgical procedure to repair the detachment. Scleral buckling and vitrectomy was ordered. Preoperative checklists were prepared and teachings were reinforced to patient IJ. After the surgery, patient IJ was transported from the recovery room back to the ENT unit for further monitoring. There were no unusual change in the vital signs of patient IJ upon the monitoring of the nurse in the unit. After a few days of hospitalization, the physician made a may go home order and patient IJ was discharged with teachings reinforced to him and to his significant others. Let's now have your high five critical thinking questions. First, define retinal detachment and the group of conditions that can cause it. Again, define retinal detachment and the group of conditions that can cause it. Number two, what is the impact of patient IJ's previous cataract surgery to the development of retinal detachment? Again, what is the impact of patient IJ's previous cataract surgery to the development of retinal detachment? Number three, is retinal detachment curable? Explain your answer. Number three, is retinal detachment curable? Explain your answer. Number four, if retinal detachment is successfully managed, is there a possibility of recurrence? Explain your answer. Again, if retinal detachment is successfully managed, is there a vast possibility of recurrence? Explain your answer. Lastly, number five, what is the prognosis of patient IJ after he underwent the ordered surgical procedure? Again, what is the prognosis of patient IJ after he underwent the ordered surgical procedure? Let's now have your daily requirements. Of course, for day 0 Tuesday, that's going to be our case scenario loading. Day 1 Wednesday, basic is GOSODPA Series 1, Nurses Notes FDAR1. Initial knowledge about the case that includes your physical assessment, pathophysiology, diagnostic test, drug study. For day 2 Thursday, basic is SODPA Series 2, Nurses Notes FDAR2, weekly evaluation, reflective journal reading, critical thinking answers. Initial knowledge about the case that includes your problem list, nursing care plan, and of course your discharge plan. For your weekly requirements, this will be the contents. You have to have your introduction, nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic test, drug study, problem list, nursing care plan, discharge plan, learning outcome, and of course your references that has to be on an APA style. Deadline of submission for day 1, March 17, 2021, Wednesday, 11:59 p.m. Day 2, March 18, 2021, Thursday, 11:59 p.m. Week 3, March 22, 2021, Monday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. This has been our my contact details, my email address, contact numbers, and of course my social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.